Been waking up with a jacked up neck after sleeping wrong. Tired of dreading getting a deep sleep only to wake up and barely be able to move your neck. Tried all the pillows and sleeping positions but continue to sleep wrong on your neck? Then this video is for you. For those of you who don't know me, my name is Dr. 𝘠𝘕𝘢𝘀, and I am a chronic pain treatment expert with over 15 years of experience, specifically for headaches, neck, and shoulder pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain without the use of medications or injections. This leads to a big increase in overall functioning, flexibility, and long-lasting pain relief. Just a quick disclaimer before we get started. I make these videos not to entertain, but specifically for anyone who has been dealing with chronic headaches, neck, or shoulder pain for at least 6 months. They've tried just about every type of treatment, and they've been lied to, overpromised, and underdelivered by the current medical model, in hopes of giving some real answers as to what is going on and get to the root cause of the problem to get some long-lasting pain relief finally. I want chronic pain sufferers to be properly educated on all their options for their treatments and be able to fully make an informed decision about how to get out of pain and get their quality of life back. Now on to the video. All right, let's get into the video. This week's question came from Melissa on Instagram. The question was, I am 33 years old and I have been living with chronic neck pain for the past 5 years. I work all day at a desk and start having neck pain as soon as I get out of bed. About 2 times per month, I have a really deep sleep, but wake up with even more neck pain and I can barely turn my head for a few days. I thought sleep was supposed to be healing and helpful, but why does it keep jacking up my neck? Thanks for sending that question in. And just a quick reminder, if you do have any questions you want me to cover, and I think I can help, please send them in. All the information to do that is included wherever you're consuming this video. But let's try our best to answer this question and get Melissa some help, because I think a lot of people are dealing with this problem as well. So what am I going to cover in this video? First, I'm going to cover why does this happen in the first place? What makes it happen? Next is what to do when this happens. And lastly is tips and strategies to keep it from happening as often and intensely. So the first thing that happens is over time, we live in this society of, I'd say, poor posture, too much sitting, looking at our devices, not moving enough, maybe moving too much. And essentially what happens is we're just not meant to be, sitting and looking down. When this happens, it causes the muscles and the ligaments in the neck, in the shoulders, in the mid-back to constantly be contracted. And when they're constantly being contracted, they don't get enough blood flow and they don't get enough oxygen. So what happens is it sends a signal to the brain that something's going on there. The same thing that would happen if you had like a direct injury, like a car accident or a fall, but it's very slight and it's very insidious. It's not like a big response right away. And then basically what happens is the body senses that there's an issue there because these muscles are really never getting a break. So it starts to pump out this stuff called adhesion, also known as scar tissue. And it tries to get in the area and fill that area in to help the muscle. In the short term, that's what it's trying to do. It's trying to help the muscle be able to handle a little bit more of that load. Now blood flow can't get in, but and oxygen can't get in. And then essentially what happens is all the waste products in the muscle, they get stuck in there as well. So this adhesion forms, and the first thing it does is it makes the area less flexible, and then eventually it makes it weaker. Then what happens is the force needs to go somewhere. So when the muscles aren't really working how they should, your body decides that it wants to use the ligaments to help. And there's this really big ligament in the base of the neck. It's really big. It takes up the whole part of the top part of the spine called the cervical spine. And basically every muscle in that area just uses that ligament to generate force, to create stability. And then what happens is your head kind of hangs out and drops down. When that does, it puts more stretch in the ligament as well. Then the ligament starts to develop that adhesion. Then it becomes less flexible and weaker. Now you got it in the muscles, you got it in the ligament, it's putting more pressure on there. Then what happens is as that adhesion gets bigger and starts to spread out in more of the muscles, what it does is eventually get stuck to the nerves. And a really common nerve to get stuck is right behind the back of the neck. It actually comes out right behind the ear and it gets caught right in between the shoulder blade in there. It's that constant knot that pretty much every human living in modern society has. And it creates what's called a nerve entrapment. Now, nerves are built with about 15% of like extra slack, like a rubber band, to allow them to just stretch and move how they're supposed to and get where they need to go. But then that adhesion gets stuck there. And when the adhesion gets stuck to the nerve, then what happens is you get some numbness, some aching, some burning, some tension. The thing is, though, the nerves do not like when they get caught. The body's number one job is really to protect the nervous system, because if the nervous system is compromised or not working correctly, what it's going to do is it's going to mess everything up. So the body will change all sorts of things. It'll kind of elevate that shoulder, roll it back, roll it forward. So a lot of people are like, oh, I have bad posture. I got to correct my posture. I got to do that. That's not the thing that's going on. You got all that adhesion there and on those nerves. So it starts back there, and then you get a lot of that tension back there, and things just aren't functioning correctly. Then it also gets caught on these muscles in the front of the neck, in what's called the nerve roots at the scalenes. And all those nerves kind of handle the upper part of the arm into the back as well, the shoulder, and they get stuck as well. Now you're stuck with adhesion in the muscle, in the ligaments, in the nerves, and that's not a good thing. So what happens is the force has to go somewhere. And where it ends up going is into the discs and into the joints. Then what happens is you start to get some damage to the disc. Now, when most people think of a disc injury, they think, oh, I have a disc herniation, I need surgery, it's really bad. It doesn't happen right away like that, especially if you don't have like a big history of trauma or accidents where all this kind of came out of nowhere. So what I have here in this slide is a picture of the disc. It's almost like if we cut it in half from the top and we're looking at it straight down. It's kind of like a tree. In the middle, you have this like jelly-like substance. It's called the nucleus, and then it's surrounded by these rings here, and they're called the annular fibers. So essentially what happens is the disc and joint is really good at shock absorbing. It can handle force going up and down. And then it also needs those ligaments and those muscles to kind of give it some stability and support. What happens over time is when all that adhesion builds up around there, now it doesn't get support. So now the disc starts to slide and grind on itself. When it slides and grinds on itself, you start to get these little tears in throughout the annular fibers, and those are called internal disc derangements. They're actually really common. And when they do happen, they usually last for 2 to 10 days. So essentially what's happening is when you're waking up and that you're locked up and that neck can't move, usually what happened was there was some micro tearing in those annular fibers. And then what happens is the body lays down a lot of inflammation all around there to protect the area. And then what happens is you tighten up and you can't move. It's the same way as if like you sprain your ankle, your body knows to limp. When it tightens up, it's trying to unload that disc and allow it to heal. Now, over time, what can happen is then you can start to get a bulge in here where it's starting to squirt out from there. Those are a little more intense. They last longer. Then eventually you can get what's called a protrusion where it breaks free. Then you get an extrusion where it really breaks out. And then you get a sequestration where it really breaks out. These are the really bad things. Those are when people get an MRI and they're like, oh my God, you need surgery right away. I also don't think you need surgery right away because a lot of times if you can clean up the tissue around there, it can take the pressure off of there, but that'll be for a different video going forward. But basically what happens is you didn't just sleep on it wrong. What happened was all that other stuff built up, the disc got really angry, and now you wake up and you're having that problem. So what to do when it happens? First is don't panic. I know when you wake up and you can't turn your head, you're like Frankenstein and your neck is all jacked up, you panic. You're like, what the hell is going on? Don't panic. Just take it easy for a second. You've watched this video, so you're educated, understand like you're not going to die. There's nothing horrible happening there, but you need to pay attention to what's going on. Next thing is don't try to move it around and stretch it. I know when things are tight and jammed up, your first instinct is to want to move and stretch it. What I talked about is when that disc is getting loaded up and jammed up, a lot of times what happens is it tightens up in that protective way to take the pressure off of there. And if you try to move it too much, temporarily it might feel better, but it's going to actually cause that internal disc derangement to get worse and have more issues in there. So just leave it alone. Just let it chill out. Next is don't try to get an appointment right away with a chiropractor or a massage therapist. A lot of people, when they wake up and they do that, they freak out and they're like, I need an appointment right away. Just leave it alone for a little bit. Let your body kind of do its thing. Let it heal it up. That's why it has inflammation, why it has things in there. Next is just slow down your breathing and breathe through your belly. A lot of times when we're stressed, we're overworked, sitting at a computer all day, looking down at our phone, we get all that adhesion around those nerves and they get stuck on those muscles called the scalenes. And the scalenes are really only designed to be like, they mostly support the neck, but they're like a secondary, what's called breathing muscle. So when you're really exerting, they kick on as well. But when those scalenes are already beat up, it's causing issues. You're really supposed to breathe through your belly, nice and easy, take the pressure off of your neck. Next is no heat. I know inherently heat feels good and you want to do that and it feels like it loosens it up and lets it go. But essentially what that's going to do is it's going to alter the inflammation process. We actually want inflammation in the short term to go in there and do its thing and open some stuff up. Instead, use some ice in the short term, no longer than about 10 minutes or so, just every couple hours, let it kind of chill in there, but don't leave it on there for like 30, 40 minutes. It's actually going to be counterproductive. Use a little bit of ice. It takes some of that ache and that pain away and some of that intensity. Next one is you got to keep trying to walk and move. This helps to pump up the inflammation and get things going. Even if you feel awful, you can't turn your head, you're in miserable type of pain. It all sucks. The more you can keep moving and do that. I'm not talking like go on like a trek, but go on like a 5-minute walk every hour or so. That's going to keep things moving and really help to facilitate the healing process. And next is just let your head stay in that position it wants to be. A lot of times when you're loaded on certain area, you're like locked up or tilted one way or the other. That's called antalgic lean. And what that does is it's really just trying to protect the area in there and unload the disc. So let it be where it wants to be, where it's comfortable. Don't just try to force it back into like its normal position. You're just going to make it angry. It's like I said earlier, it's kind of like when you sprain an ankle, to limp. It's the same thing your body's doing to unload that area. And lastly, just be patient with it, and continue to just leave it alone for the first 72 hours. I know when you're in pain, you panic, you want to do that, and you'll call a chiropractor, you'll call a massage therapist, and they'll get you in right away. The problem is when they get in there and treat that, it does temporarily release some of that muscle and that tension in there. But what happens is it actually exposes that disc a little bit more. So you might get a day of relief, but then you're going to get 5 or 6 more days as you go. Think of like, as soon as it happens, to kind of start that clock, let it kind of chill out. Don't panic, move around, breathe, use ice, keep walking, and just let it chill out. Because if you move it too much, you're going to be starting all over again, and you're going to have repeats of these neck problems over and over again, and they're never going to go away. So a couple of tips and strategies to keep it from coming back as often and as intensely. First is try not to stay in bed too long. And when you wake up, just get up. I know it's nice when you're laying in bed and it's comfortable and you don't want to get up, but sometimes if you if you have a history of disc issues and pain in there, if you're laying on those discs and those muscles for too long, it can actually cause some issues. So when you wake up, as much as it sucks, just get up. And a big thing is you want to get up and you want to move around. I'm not talking like go for a run or anything, but get up, get walking around the house for 5 or 10 minutes or so, and get hydrated. When you're sleeping, gravity isn't acting on you as much, and your discs actually get more dehydrated and they don't have enough fluid in there. So if you get up and you move around, that helps, but then hydration helps as well. I always recommend like 20 to 30 ounces of water when you first get started. A lot of people are like, oh my God, that's so much, but it's going to help flush everything out, help you feel and function a heck of a lot better. Next one is just watch yourself throughout the day on your devices. I follow what's called a 4-finger rule. So basically, anytime that you're looking down at a device, you should have 4 fingers in between your chin and your chest, and they should be 4 spread out fingers. And a lot of people want to cheat from there. Another thing too is when you are looking at devices, instead of bringing your eyes to the device, bring the device to your eyes. Phone up high. Who cares what you look like? People are like, oh, you look weird. Hey, keeping my neck healthy, putting myself in a good place. Next is get to a provider that specializes in treating adhesion and nerve entrapments. And if you're having trouble finding one, just reach out and I can get you in touch with one. We have providers all over the world that excel in finding and fixing nerve entrapments and treating adhesion to take the pressure off of there and keep this from coming back as often. Then once you get the adhesion treated, and you get functioning better, you get moving better, then you need to start working on building up strength in the front part of the neck. Your neck actually has a core like your lower body, and then also in the mid back as well. What happens a lot of times is people want to do these stretches or exercises and build up strength before they get the tissue healthy. You got to get the tissue healthy by getting the adhesion removed. And that's exactly what the providers train in the peak method, what I teach and train, are able to do. They get in there precise and focused with their hands and an instrument, and they're able to break down that adhesion, get rid of all that adhesion, get things functioning better, moving better, then start to strengthen it and start to build it back up. And lastly, just take some damn breaks from being on your phones and devices. There's never anything really that good on there unless you're learning from me and watching this video. So that's all I got in the video. If you are struggling with this, you haven't got any real answers, there are people out there that can help you. The best providers in the world for treating adhesion and nerve entrapments are trained in my system called the Peak Injury Treatment Method. And when you've had enough of constant neck pain and discomfort, reach out directly to us and request a no-charge neck pain consultation to get some real answers as to what is going on and on the path to long-lasting pain relief. Information to request that is included in our profile or wherever you are watching this video. I hope it was helpful, and we'll see you on the next one. Bye.